Hello everyone, my name is Juan Cantu, and I'll be going over the following slides on healthcare administration based upon significant changes that are happening within the U.S. healthcare environment. And I will also be comparing those to other countries in the following slides. Healthcare administration system, there's different areas of expertise that are done in the healthcare facility or the healthcare setting. Some of the following are overseeing the process of procedural practices in healthcare organizations, setting healthcare facility budgets, ensuring healthcare facility adherence to healthcare laws, rules, and regulations implied by the state, implementing new and effective methods for quality patient care, and some other important tasks for healthcare administrators are cutting unnecessary costs, overseeing organization of patient files and records, and scheduling employees accordingly based on clientele needs. Now, there's several changes that are needed in the U.S., and the focused topics that I've chose were on healthcare coverages and spending, pharmaceuticals, and healthcare management, along with public health, which includes anywhere in home, hospital, or nursing home, any healthcare setting. In the U.S., currently, the health sectors have undergone various changes in almost every aspect of healthcare, with the biggest changes involving healthcare facility reimbursements that are received. And before each fiscal year, most hospitals and healthcare facilities try to forecast their expected performances in areas of financial stability. After the end of the fiscal year, most U.S. healthcare facilities will analyze their predictions for the year and against their actual performances for the year that they just did. And pharmaceuticals, a huge part of the healthcare industry is pharmaceuticals and the budget for pharmaceuticals in the US. And there are many variables involved in the US as far as pharmaceuticals due to wastage, overcompensation, or non-compliance of medication from patients. And along with this, there comes a lot of manufacturing, shipment, and production costs that play a big effect on it. With the biggest impact stemming from the COVID-19 in the healthcare management and public health setting, there's many challenges that have presented themselves and very negative impacts throughout the world. All areas of public health have been challenged with a task to providing healthcare coverage to those and all private, state, and federal organizations. Healthcare management groups are limited to RNs and LVNs due to low staffing and manning issues, which reduce the required amount of service needed by the patient or member in their healthcare facility. These problems are usually more evident to those affected in higher poverty or in urban locations, or people who don't have the availability of resources such as telephones or computers. So in the following slides, I will be presenting different countries and how they match up against the U.S. in the areas of healthcare coverage and spending, and pharmaceuticals, and healthcare management. So in U.S. healthcare spending versus the other countries, you can plainly see that the U.S. is dominating all other countries almost by half as much. And the three other countries that I'll be concentrating on will be Canada, Germany, and Japan. And you can see that the U.S. spending costs for ambulatory healthcare, which involves ER and trauma and urgent care centers, is very, very high. as well as the hospital and nursing home. So as mentioned before, we're going to be talking about Canada, Germany, and Japan and how they measure up to the US. You can see in the graph before that the US pretty much exceeds all these other countries by more than half of the amount in spending in all categories. So we'll be discussing, as mentioned before, in healthcare coverage and spending, also the topic of pharmaceuticals and healthcare management and public health. The first country I'll be discussing is Canada when it comes to healthcare coverages. Canada has a decentralized universal healthcare coverage system that is publicly funded, and this ranges to $2,000 of Canadian money per year per person, or about $160 a month per person. Now, what does decentralization mean? Typically, the healthcare systems with decentralization, they put the decision making away from the centralized control and closer to the user of the health services. So it gives more control to the individual or the patient. A lot of countries adopted this idea of decentralized healthcare systems to help improve their responsiveness and performance for the healthcare of the individual seeking care. As you can see by the figure 1, there's a lot involved in this, but in the end, the individual is solely responsible for their health care and attaining care when they need it. The next country we'll be discussing is Germany. In healthcare coverages, Germany has public and private coverages, and the cost range for those coverages are about $110 to $120 a month. And their coverage also allows their citizens 28 days of inpatient hospital or extended stays in the hospital available to everyone. And Germany does not have a specialty provider referral system, meaning that anyone can see any kind of specialist without a referral, such as a cardiologist, ophthalmologist, or ENT doctor. And their coverages are solely based upon income, meaning the healthcare is affordable for everyone, regardless of how much they make. And you can see by the graph in graph 2 where most of the healthcare coverages and spending go to the country. And our last country that we'll be presenting is Japan on healthcare coverages. Now, Japan average cost is about 10,000 yens per visit, or about 91 US dollars. And Japan currently has a universal public healthcare system for all, which is currently legally required by the country. And the average of public health insurance is approximately 5% of the income per person. That's just an average. And there are 3 types of insurances for Japan. And these insurances are national health insurance, social health insurance, or nursing insurance. You see, national health insurance is more like our standard Medicaid, Medicare type of insurance, and the social health care insurances are what we routinely use as insurances, like our insurance companies, and nursing insurances are more like for disability of individuals in Japan or those requiring nursing care facilities or home health care. In the current graph here, you can see where the average percentage of the GDP are due to healthcare expenditures. I wasn't able to find Canada on this particular graph, but if looking at slide 5, you can see that Canada just sits just below the US and just above Germany as far as expenditures go for healthcare. Now we're talking about pharmaceuticals, and the following chart in figure 1, it shows the countries with the biggest global pharmaceutical markets in the world. And you can see US followed by Japan is in there, then Germany, and Canada sitting there in 9th place. But along with the big market growth of US pharmaceuticals and in relation to the other countries, there is also a lot of expenditures to the patients, trying to find lower drug costs. Typically, internationally, all retail drug prices are much lower. If you think about it this way, the same drug in America can cost 3 to 5 times more than its price abroad. And this is a big explanation on why the US is having to cover such a large portion of the expenditure of the drug development, and why pharmaceutical company prices and drugs are much higher than on domestic soil. The foreign help is not available, and its situation has caused the US to spend over 17% of its GDP just on healthcare alone, with pharmaceuticals being about 11% of that. As shown in some common drug costs in the US versus Canada, in figure 4, the drug costs can be seen to be 3 to 10 times more than in Canada. A huge part of this phenomenon stems from the US pharmaceutical industry overcharges on insurance. Many times the insurance company covers anywhere from 15 to 80% of the drug coverages towards the American people. Yet these coverages tend to only pay what the industry's profit from their customers. Rather, what is left to pay by the consumer is the amount the drug would have cost in Canada. These widely seen costly effects in all aspects of healthcare are one of the main causes for insurance companies to drive up costs and rates. The primary focus for all the countries involved in this research is to maintain a healthy lifestyle during the current pandemic. In practically every setting in life, the World Health Organization and the CDC have incorporated rules and regulations based on the coronavirus. And for all those who are frontline workers in healthcare, the primary focus relies on the preventative measures to ensure the health and safety of all the people. The public health crisis pandemic that is currently going on right now is like any other that has been witnessed in the past. Vaccinations are the key to preventing the spread of the coronavirus in every country, including US, Germany, Canada, and Japan, where all economies, industries, and healthcare facilities have been vastly negatively impacted by the coronavirus. All countries had an even distribution of rankings in areas of best, worst, and average. In the category of healthcare coverage, Germany had the top ranking. This was evident in those areas due to having cheaper costs of healthcare coverages, which were entirely related to income, which allowed all of its citizens the ability to afford decent healthcare coverages. Canada had the highest score in pharmaceuticals due to the lowest average drug cost among the 3 countries. Canada's healthcare coverages were among the priciest of the 3 countries, which gave them the worst rating in the category. Japan had the highest score of the healthcare management and public health topic. This score was accumulated through average population to to death ratio in 2020 during the COVID-19 pandemic. Pharmaceutical rankings were accumulated by drug cost savings from each country, with the highest savings coming from Canada. Some recommendations that I have are strictly on the foundation of the healthcare system. And I believe the people who make up that foundation are our nurses. Now, it is through our nurses that, we look upon as leaders, and we look to trust them and their decision making, not just for the patient, but for all medical staff involved. That's why I incorporated these 3 areas where U.S. healthcare systems could improve in, involving more enhanced nursing. Now, number 1 states that nurses as professionals need to practice to the highest degree of patient care attained in their education and training. So this means coming out of school, they need to practice to the highest level possible in their learning environment, even if they're new. But as they're growing through the years, they must practice at even higher levels and try to attain, which is my second point here, the nursing professionals should try to enhance and achieve a higher level of training through advanced educational systems that will allow continued progression in their academics. Now, me myself, I know I first got my associate's degree in nursing back in 2013, 2014 timeframe. And after a year's time, I was able to get my bachelor's in nursing because I did not want to just stay stagnant in one area. So I wanted to pursue another degree outside of nursing, just so I can apply nursing and business at one and try to create something of my own. So that's why I strongly feel that enhancing the nursing population, enhancing their academic levels, will also enhance the U.S. healthcare system, not only just for pharmaceuticals, healthcare coverages, and healthcare management and public health, but in every aspect of medicine. I think without educated nurses, enhanced nursing environments, and collaborative approaches to improving the healthcare industry, which is my third point, nurses need to collaborate as leaders with all healthcare workers on every level of gather data, enhance information infrastructures in areas of policymaking process and efficient planning. All these come together and it improves our healthcare system up and down the line. And I think it is through our nurses, who are our backbones in healthcare settings, to strive to improve themselves by receiving higher education in their respective fields. Without the nurses' increased development, the healthcare system would stay stagnant as well. And in a stagnant environment, you would see a major decline in all areas of medicine. Well, my name is Juan Cantu, and I'd like to thank everyone for being here today and enjoying my slideshow. I appreciate your time. Thank you.